Hello everyone, Dr. Charlie Johnson. I want to talk to you about what the heck happened during the slump test, okay? So in a previous video, I reviewed something I called the slump test, and it is a test used to help you determine whether or not the stiffness that you felt in the back of the leg was due to a pulled muscle or tension in your hamstring or a problem with the nerve. So if you remember, as we were sitting down, we actually used movements of the head to either turn on or turn off symptoms in the leg. We didn't move anything with the leg, we just moved the head. Therefore, it could have not been anything with the muscles. It had to have been something with the nervous system, okay? So here's what happened. So what you have to first understand is that this right here, hopefully you can tell, is a picture of a person or a diagram of a person as they're sitting down. From a side view, here is their head or their brain, and all the way down here is their foot. First thing you need to understand is that the nervous system, the brain, the spinal cord, and all the nerves that go down the back of the leg are a continuous sort of cord, okay? So what we did during the slump test, remember, is I had you bring your chin to your chest and slouch. And what we're actually doing there is we're actually pulling the whole spinal cord upwards, okay? So you're pulling this end sort of that cord or that rubber band. And what we feel is actually, when we look at it, okay, when we look at what happens to the spine, we actually see that when we bring the chin to the chest, the nerves actually move upwards all the way down to the level of the lower back. So it sort of pre-tensions that wire, okay? And then what I had you do is I said, okay, pull up the toes and try to straighten the knee. And then you can imagine if we had tension on it from above, then what we tried to do is we tried to further tension the cord from below, putting maximal tension sort of on that string as it went around the loop, right? And then what I said is, okay, lift up the head. And as we lifted up the head, obviously, we kind of reduced the tension from above on the cord, which allowed some slack in the system and your symptoms to go away. So during the slump test, you put tension throughout the nervous system by tensioning the cord from both ends. And if a nerve is sensitive, you will often feel your pain, numbness, or tingling in the leg that you injured. So pretty cool stuff. Another thing is think about the day-to-day things you're doing that put you in this position, right? In later videos, we'll talk about people who have maybe pain, numbness, tingling in one leg and the issues they have with things like driving or maybe reading a book, right? If you're reading a book, you're kind of tensioning the cord from above. If you're driving, maybe you've tensioned the cord from both ends. And we'll give you some strategies to change the way you feel when you're doing those activities. So if this is you and you had another aha moment, email me directly at charliejohnsondpt@gmail.com and I'll help you out.